Hey guys, hope you guys are doing well. Today I'll be talking about technology in medical innovations. Firstly, I won't really be stressing on medical diseases or anything like that, but I'll be talking in terms of more technology perspective. How new technology has been addressing the problems in medical field and how it's been speeding up some of the processes and finding cures for long time diseases. So, firstly, when we talk about technology, there's a lot of sectors, there's a lot of things that come into technology. A lot of technologies are involved, a lot of programming, a lot of IoT, smart device thinking, a lot of yes and no. There's direct technology involved in the field when it comes to surgery performing, robotic surgery, what we're thinking about currently at this moment. But also there's an indirect technology, and when we talk about indirect technology is basically, we talk about Apple Watch, smart watches, or smart apps that we use on the phones. A lot of athletes these days are using these smart apps to track their calories, track how many steps they've been burning, track their activity progress. So if you see a lot of cricketers, they use Apple Watch because Apple is one of the most proficient bands when it comes to tracking the steps, tracking the activity things. So a lot of people use Apple Watch in terms of just to know their physical fitness, how much they've kind of burned in that session out. So that's about indirect technology. It can promote you to stay fit when it comes to Fitbit, things like that. But when it comes to direct technology, it can be something like 3D printing. You're using the indirect way of 3D printing to find arms and legs. You're trying to print. So these days, a lot of people are trying to print arms and legs for handicapped people, and 3D printing had a huge effect. So one of my friends, Dr. Jarvis, was part of my institution. So he worked on a technology. He worked on a 3D printing arm, and he sold it for something around $99, which is equivalent to 5,000 rupees. Two arms. So he did two arms, for like kind of a wrist for people, and they were really well. They helped burn fingers, things like that. So these kind of technology replacements have been helping a lot of people lately. And when we talk about even when we come significant technology references, so significant technology differences are when it comes to robotic surgery. Robotic surgery has been something that's been in the talks lately, and it's been in the talks since the last 5 or 6 years when we started to enter this smart era. Smart thinking. Are we going to have robotic surgery? Are robots going to be replacing humans, or is there a way that's going to be speeding up the medical process? Yes and no. So it's a completely different opinion. People have a lot of different opinions, but I don't think robotic surgery is something that can be done at this stage, or I don't think it's something that we should be addressing, because it's sometimes it's very important that humans do some things that are more sensitive, because irrespective of your religion or your place or your mind, you would just trust a doctor. You trust the instinct of a doctor. So something I don't think we've really developed or grown into that space where we can invest in that robotic technology. And with the COVID situation, definitely in the terms of economical crisis, something that needs to be really looked upon. But when it comes to even significant technologies that we're talking about, for example, see, we've looked at the new plasma therapy. We looked at the new plasma therapy in COVID situations. How the plasma can extract the antibodies out, and using that against to fight COVID. But also in terms of new technology, we've got the COVID tracing app. Some countries like Australia, all the G7 countries, the economically forward countries, have been using the COVID Safe app. So the COVID Safe app, basically when you enter your data, things like that, if you come in contact with someone that has got COVID, because of your GPS navigation and these kind of algorithms, it would straight away alert you, and you would probably go into isolation. So this has been one of the ways that people are trying to combat COVID at this situation through the help of technology. But what I really want to mention is that anyone that's interested in medical field, particularly, so you don't have to be a doctor. So I'm particularly not a doctor. I'm not really a chemistry student. I'm not really a biology student. But I do know the fundamentals of basic science. And but I'm more towards, I'm a computer science. So I'm more towards technology. And the good thing about 21st century is that we work in the fields that are more life experiences, that require life experiences. For example, even if as well as I know technology, if I want to collaborate with someone, I need to identify the gap. For example, let's say, I can go, with the programming skills, I can work in a medical field. I need a doctor. So, because the doctor knows, what's currently missing. He has the experience of teaching patients, and, he currently knows, oh, no, this is going to get accepted by the medical board. This is not going to be accepted by the medical board. So, working with the doctors, is it's one of the ways. So, you're collaborating with that gap in the market, trying to find a new resolution. So that's one of the things. If you're a public health officer, you're really concerned about community health. You're concerned about what's happening towards community local areas. Water is not coming in, water's not clean. You're not getting a really good lifestyle out there, and you think people are getting really affected, and it's kind of prone towards diseases. That's when you get in terms of organizations. You've got World Health Organization, you've got World Vision, you've got different organizations that are trying to make these facilities better. So this can also, in terms of reflect on medical health, providing really good medical health in terms of situations. So yes and no. So for example, if you're a young graduate of a doctor, what I would recommend is, is to work with young entrepreneurs or young technology leads or young technology innovators. So this can be a really good experience. When you come from different backgrounds, certainly you don't have to be coming from one background, because when the technology wasn't there, when the lifestyle wasn't this advanced, even when we talk about 20 years back, you had a lot of doctors were doing their things. When you talked about computer person, it was basically a software job. But now, when you talk about a computer science, it's a range of fields, ranging from computer to developing smart devices, developing self-driving cars, developing what do we say, developing technology for flights, developing medical innovations, and developing kind of different innovations to address different communities in different needs. So that is one of the things. So what has changed for 21st centuries with the technology is that it's the art of collaboration that matters, and it's the willingness to learn, it's the willingness to collaborate with others, and it's the willingness to share ideas to create something new. So if you're a really young graduate and you're really looking into different possible areas, it's very important that you communicate with your peers, communicate with other faculty members, and to see what resolution you can come up with in terms of your own community needs. So I hope you've learned something today in this session. And particularly, yes, I didn't really talk about medical diseases, but when it comes to something that I would really say in this COVID time is that to battle COVID, we've got to follow the rules. Certainly, yes, we have to live with COVID. Vaccination may come, may not come. Some vaccinations don't really exist, but we've got through them. So in this times, we will get through them. So if you're a young graduate, you're really concerned about how's your world looking. If you're a doctor, will I be able to join the frontline warriors? Seriously, we're proud of all the doctors. We're really proud that doctors exist today, and because of doctors, we've been able to combat the deadly virus. Not extending it for so long. So yes and no. There will be pros and cons, but definitely what's really important is that we will get through this. It may just take a couple of months, but definitely life is going to not going to be the same. And when we get through this, all of us can look back and say, we've been through this. We've achieved a sense of achievement. And special thanks to for the coordination of this video, for for educating the kids out there, educating the teenagers and young graduates. So I hope you would like really look into technology and medical innovations, and you can feel free to email me for any more queries. Thank you.